The ACS network team over the past 2 years has developed, in collaboration with key stakeholders, 17 provincial recommended standards for the evaluation and treatment of suspected cardiac chest pain. This video highlights each of the 17 recommended standards, so sit back and enjoy.
Are you guys the post-TNK STEMI?
We sure are.
Okay, well come on into Y2 and we'll just wait for the cath lab team to arrive. Hi Mr. Smith, I'm Dr. Allen. I'm from the CCU. I'm just going to get sent over from the team here and then we'll get started, okay?
Yes, okay. Can you tell me a little bit more about Mr. Smith?
Sure. Mr. Smith is a 62-year-old male. He has a history of diabetes and smoking. He developed chest pain at 12 o'clock today and arrived at the hospital at triage at 1 o'clock with the chest pain. At that time, we activated the ACS protocol and did an EKG at 1:08. So the ER physician looked at the EKG right away and recognized that it was an anterior STEMI. So since we're based more than 100 minutes from St. Boniface Hospital, and he has no contraindications to the thrombolytics protocol, we gave him some T and a K about 1:30, and that was about 30 minutes after he arrived at the hospital. He also received ASA, clopidogrel, and enoxaparin according to our thrombolytic protocol.
Okay, so did his pain improve and do you have the EKG after the lytics?
Yes, his pain and his ST elevation have improved. However, as soon as he received the TNK, the physician called the cath lab to transport him. You know, that drip and ship thing.
Okay, all right. Thanks, Mr. Smith. We're going to take you over to do the angiogram in just a moment, but just a few questions before we get started.
Good morning. How can I help you?
I've been having chest pains for the last 20 minutes. They're really, really bad, and they just won't go away.
Okay. You did the right thing coming to emergency this morning. I'm going to take a set of vital signs and then we'll call for an EKG right away. Okay? Hi. Can you please call a stat EKG to ER? I have a patient here with chest pain. Thank you.
Hi, Dr. Zirov. Can I have you to look at this EKG?
Of course. Well, there's no STEMI, but there are some ST segment changes, so she should get a bed soon.
Hi, Mrs. Brown. I'm Dr. Cloutier. The nurse told me what's been going on. How long have you been having chest pain now?
For 20 minutes now, but had an episode earlier this morning when I was having a smoke.
Okay. Do you have a history of heart disease?
Yes, I certainly do.
So Justin, what do you think is happening?
So this is a 70-year-old female with history of smoking, hypertension, and diabetes who's presenting with 3 episodes of chest pain in the last 24 hours. She has ongoing pain right now.
Okay, what would you like to do?
Going through her TIMI risk score, she's over the age of 65. She's on ASA at home. She has more than 3 cardiac risk factors, and she's had more than 2 episodes of chest pain in the last 24 hours. She also has ST depression on her ECG. It gives her a TIMI risk score of 5. I'd like to start treatment for her end-STEMI and get her chest pain under control. I'll start loading doses of ASA to Kegrelor, anticoagulate with either heparin or enoxaparin, and start a high-dose statin. Also for her chest pain, I'll start a nitroglycerin patch.
Okay, good. I agree. So let's say you reassess Mrs. Brown in about 30 minutes and she's still having chest pain. What would you do then?
Her TIMI risk score of 5 makes her high risk. If we can't settle down her chest pain, I'd call the cath lab for an urgent cath. Also, if she develops any arrhythmias, heart failure, or cardiogenic shock, I'd be very worried and I'd call the cath lab as well.
Good. You're correct. The ACS network clearly recommends standards for when patients should be referred for cath. If Mrs. Brown had a TIMI risk score of 5, but no high risk or unstable features, she could be referred for cath within 72 hours of first medical contact.
Hi, Mr. Jones. I'm Dr. Dukas. You're having a heart attack right now. That's something we call an ST elevation MI or a STEMI. The way to treat this is to do an angiogram, find the blockage, and unblock it right away. I'm going to tell you a little bit more about this. Okay, he's got it blocked right. Open me up a JR4 guider. Give me a PT Graphics intermediate wire. We got to get this vessel open up within 20 minutes.
Okay, for sure.
Mr. Smith, our first patient, was admitted after his coronary angioplasty to the Acute Cardiac Care Unit. Let's see how he's doing.
Hi, Mr. Smith. Welcome to the Acute Cardiac Care Unit. My name's Chloe and I'll be your nurse today. How are you feeling right now?
I'm feeling pretty good. That chest pressure is nearly all gone, but I have another problem now. I'd really like to have a cigarette.
Okay. How much were you smoking before your heart attack?
Smoking a pack and a half a day. I'd even wake up during the night and have a cigarette, but I always had one in the morning, and now I feel kind of anxious. I'd like to have one.
Thank you for telling me this. Let me go talk to the pharmacist and I'll see if there's anything we can do to help you with your cravings.
Thank you.
You're welcome. I was speaking with Mr. Smith and I think he's at high risk for withdrawal. Do you think he'd be a candidate for nicotine replacement therapy?
Yes, I agree he's at high risk for withdrawal. I will go speak with him further.
Hi, Mr. Smith. How are you feeling now?
Well, I'm feeling pretty good. That nicotine patch you gave me and that gum are really helping me out with my craving. I'm not getting any chest pressures.
That's great to hear. Now that you're a little bit more relaxed, I'd like to talk to you about how your stay here will go. During your recovery, you'll be meeting with several different healthcare professionals, and they'll be talking with you about your heart health. This book here outlines that information, and you can take it home with you. And one more thing, this guide outlines on a daily basis what you can expect as part of your care. So So do you have any questions or concerns right now?
Not that I can think of. Oh yes, maybe one. How long will I stay here?
You'll be on this unit for the next 24 hours, and then depending on how you're doing, you'll transfer to the cardiology inpatient unit.
Okay, thank you.
You're welcome.
Mrs. Brown, our second patient, is ready to be discharged home. Let's check in to see how the staff is preparing her for discharge.
Hi, Mrs. Brown. Are you looking forward to going home?
Yes, I really miss sleeping in my own bed. But I'm committed to doing all the things that the dietitian, the physiotherapist, and the pharmacist have told me about.
That's good. Your family doctor will receive a hospital discharge summary. It's very important that you see your family doctor within 90 days of discharge.
My daughter's already called them. But I was wondering if I'd have enough medications to last until I see my family doctor.
Yes, you've been given a 90 supply.
That's great. One more thing, the physiotherapist mentioned a referral to the cardiac rehabilitation program. Has this been done, or do I have to do it?
No, the referral is automatically made for you. You should hear from the cardiac rehab program within the next few days or shortly after your discharge, okay?
Oh, that's wonderful. My daughter will be attending with me, so it'll be great for both of us.
Well, that sounds very good. Well, I wish you all the best, and I hope that you are very well after this.
Thank you very much.
You're welcome. Take care.
Now let's see how Mr. Smith, our first patient, is doing at his first clinic visit.
Hi, Mr. Smith. I'm Dr. Hebert. I'm a cardiology trainee here. So how have you been doing since you left the hospital?
It's been a bit rough, but it's going really good now.
Oh, that's excellent. Great. And remind me, it's been about 5 weeks since your heart attack, if I'm not mistaken?
Yeah, I believe I was released about 4 days after the angiogram.
Oh, yeah, that's always a good sign for sure. Have you had any chest pain at all since then?
No, everything's been going good.
Great, excellent. And how are your medications going? Any problems at all?
No, there's a lot of pills, but the pharmacist helped me out quite a bit about understanding them, and I'm still wearing the nicotine patch for my craving, and it's going really good.
Oh, you know what? That's great. I'm really glad to hear you're thinking about quitting smoking. And you know what? I'd be happy to help you with anything else if you have any questions too.
When I left the hospital, they gave me some booklets on it, and there was also a hotline, and I phoned it once.
Oh, excellent. That's great. And are you attending cardiac rehabilitation?
Yeah, I joined the refit center, and it's working out good.
Excellent. Great.